Hi, everyone. This is Debbie Baaske, Member Engagement Manager at Rails. And today we bring to you a specialized library spotlight. I'm here with Brenda, who is from the American Hospital Association. Hi, Brenda. How are you?
Hi, fine, Debbie. Thanks.
It's nice to have you here. Would you like to tell us a little bit about yourself?
Sure. Happy to, and thanks for inviting me to participate in this series. I am the director of the American Hospital Association Library. I've been with AHA now for 5 years. Prior to AHA, I was at Abbott Laboratories for about 14 years in their library. So I've been in the library profession about 35 plus years with many different experiences throughout my career. Starting as a Peace Corps librarian in Brazil and
Oh, wow.
quite a few different types of libraries, including bank marketing. Of course, I said pharmaceutical, insurance company, just a large variety of really fun places to work throughout my career. So
That sounds really exciting. You could teach one of the library school classes so the students can learn about all the interesting jobs you can have in librarianship.
yes, and who knew that these past couple of years at AHA, we would be front and center supporting our frontline healthcare workers at AHA nonstop throughout this COVID pandemic. So this has been really a very exciting and fulfilling place to be these past couple of years. So
I can imagine. Would you like to share more about what you actually do there and what your what services you offer?
sure. So AHA was founded, just so people know, in 1898. So they're working towards almost coming up on 125 years. And the Resource Center has been in existence for about 90 or just over 90 of those years. So the Resource Center at AHA has a long standing tradition. They've been very active in the past in producing reference books and literature guides for the healthcare, for medical libraries. But lately, we are a smaller staff now. We are 5, 4 researchers and our technology specialist. And we support, the way we look at it, 3 main audiences of AHA. First is the AHA staff, and that's about not quite 500 staff, located primarily in Chicago and Washington, D.C., but we have regionally located staff as well. So we do need to be very, have a strong online presence as much as possible, digitize our resources. Then our second group of users is our AHA members, and that's just about 5,000 US hospitals, their C-suite staff, as well as over 40,000 individual members that are part of about 10 or so different healthcare professional groups. So it's a very large membership base that we serve, as well as the third category, which is the general public. And that includes researchers, journalists and reporters, students, other healthcare association personnel, consultants, law firms, healthcare vendors, and partners of AHA. So that's a very big category as well. And we were doing a lot of that support for journalists and reporters, as you can imagine, over the last couple of years, who were looking to get hospital statistics and data on hospital capacity, ICU bed information during COVID. So we were quite busy servicing that part of our audience. So that's basically who we serve. We think about our offerings, our services that we provide sort of as information and data. And I'll explain that a little bit more. We very much provide traditional library services like research support for all 3 of those audiences, anywhere from ready reference to in-depth support, document delivery and interlibrary loan, creating alerts, giving folks access to our online databases and journals. We maintain an extensive collection of AHA publications through our online catalog that anyone can get to. And we do a lot of copyright support. So when external folks want to use AHA materials, we help them get the proper permission. And when AHA employees want to publish something using non-AHA material, we help them obtain the proper usage rights as well. So within all of those traditional services, we have some non-traditional types of things that I thought might be interesting to call out.
Sure.
So within the research area, AHA surveys over 6,000 US hospitals annually, and that goes back to the 1980s. So we have a very large, robust data set of healthcare hospital data. And this is what we call AHA's big data. And the Resource Center team is very well versed in this data because we use it daily to answer reference questions about, hospitals of a certain size, what types of services they offer, patient volume, that sort of thing. We also use the database very frequently to answer or to fulfill requests from external customers who want large trending reports of this data, and that generates some revenue for the organization, for our organization. And then we also just recently have started working with some internal subject experts to take the data, identify trends in a particular area like behavioral health or rural health, identify those trends that might be of interest, and create infographics around that data to sort of, a picture tells 1,000 words. So we've gotten we're dabbling our toes in the data visualization part of data. So we've had a lot of fun supporting this area, and a lot of what I'm talking about, you can see on aha.org. So on the organization's website, and up at the top, if you go to the data tab and scroll down, the Resource Center is there. Anyone can click on it, go to our page, and see all of these things that I'm talking about. Much of what we do can be shared and is out on aha.org. Of course, there are proprietary internal things that are only on our internal portal. But anyway, so that the AHA survey work that we do is I would say maybe non-traditional. We also are trying to get people more aware of how to set up alerts in things like PubMed and Google, because there's so many hot topics in hospital administration and healthcare right now that it's hard to keep track of it all. And so there are about 10 or 12 topics that we're working, and we get AHA gets a lot of grant funded support projects as well. And the Resource Center is front and center on those. So we're working with these teams to learn more about setting up dynamic search links in PubMed that can be shared internally and externally. It's a great way to track the peer review literature on a particular topic. So we're doing a lot of internal education with our staff on these resources. It's very exciting. They're super excited to have these resources and people who know how to use them within AHA. And I would say that one other thing that we've implemented in the last couple of years is a self-service platform through the Copyright Clearance Center that links to our subscriptions, so that when anybody in AHA goes to the platform, if they're looking for an article that's in one of our databases or journal subscriptions, they will have access to it immediately. If it's not, they have immediate ability to purchase that article, and it then gets added to our document library, which can be reused internally at no additional cost. So we're trying to implement some of these cost savings, time savings, platforms and services, if you will, so that folks can access them 24/7 and they're not completely dependent on us.
Right. Well, I mean, what you do is certainly always been very important, but really timely now over the last couple of years, that's for sure. You already touched on this, but I'm just curious, any like big surprises over the last couple of years? I mean, obviously your job, I'm sure, has changed with the pandemic, but any, insights or big surprises from the work that you've been doing?
Insights, I would say the more it's when I first arrived at AHA 5 years ago, there's a wonderful legacy that the library has had of reaching out to hospital libraries and our member associations. And it's not to say that they weren't really tied into the internal AHA staff as well, but I felt that there was a lot of work to be done because I kept hearing AHA staff say, "Oh, I didn't know the Resource Center could do that." That
Sure.
phrase that no librarian likes to hear.
Right.
And so we had the technology for our portal for the internal AHA portals was just switching over to SharePoint, and I had been familiar with SharePoint from my previous job. So we embarked on creating a much more dynamic, much more interactive site portal for the resource, and put a lot of these things that I was talking to you about on there. But one of the ahas that I had was, you can tell this group that you do this, you can tell this group that you do something for them, but they forget it goes in one ear and out the other, right?
Sure.
And tomorrow they go, "Well, I don't know if the Resource Center can do this." So on the portal, we created a page where we've listed 20 of the most typical types of research that we do. We describe the research in detail, and we give them a link to a sample so that they can actually click and see, oh, if I ask for this kind of research, what might the results look like, right? And how can I? So that has been tremendously useful when we do new employee orientations, when we talk to teams and staff meetings, so forth. They've got it all, they've got it right there. We're constantly updating it. But so I think that was one thing. And another thing is we were doing a pretty good job of collecting metrics like most libraries do, but we weren't doing a very good job, I did think, of sharing those metrics, sharing the ahas and the trends of what we're doing with our internal folks. So we now have a dashboard, and thanks to we report into the data strategy team at AHA. Mm-hmm. Reports to the Innovation Center area of AHA. So we have a lot of very dynamic, creative thinkers that we can tap into, thankfully. And one of them is a Tableau whiz. And so he helped us create this KPI dashboard page on which we put metrics in interesting ways about who we do work for, what type of work we do, and how much. So one of the things that we wanted to show, especially our regional execs, was how much work we do directly for AHA hospital members. So we have a map, and then if you click on each one of the states, it pulls from our request tracking system and shows which hospitals we've directly supported, when they called us directly, and how many requests we've done for them in the year. So it's kind of an interactive map that they can hover over and see, and we've touched we've touched hospitals directly in 40 out of the 50 states in the US. So it's
amazing.
At a glance visual. And then there's a little wheel that AHA has to kind of to denote the different parts of AHA. And we took that wheel, and same thing, you hover over it and you can see how much work we've done for each parts of AHA by department. So we're trying to get people. And then one more thing I might mention is I really wanted my staff, who get all kinds of kudos and great feedback from their customers, I wanted that to be a little bit more publicly available. So we created a Kudo Board. And what we do is we describe the project, put the feedback comment, and then not the name of the person, but their title or their organization or whatever. And that page gets a lot of visits because it kind of gives you a little more granular idea about what types of research, the variety of types of research that the Resource Center does. So these are ways that we try to tell the story of who we are, what we can do. And I'm not hearing as much of, oh, I didn't know the library could do that. That seems to be lessening.
Sure. Well, that's
We're
great
getting the word out.
information. And for those listening that might work in libraries, I think you shared some good ideas how they could tell their story better. So thank you for that. And thank you for joining me today. I really appreciate it. And I've learned a lot. And thank you for all the work that you do to support those libraries and the hospitals. It's really important. So thank you.
Thank you to Rails for having this series. This is wonderful.
You're welcome. Have a good day.